Good morning, good morning, Dr. Erum. Dr. Erum, I'll call. Right? I always
Yes.
say it wrong. But good to see you after such a long time. I think it was last time, I think it was end of June. I remember,
Yeah, probably.
yeah, that was my granddaughter's birthday that day. So that's why I remember.
Yes.
Been busy, and then I know your schedule has been changed a little bit due to your change of job and all that. But
Yes, yeah.
yeah. So I'm glad to see you today. And we been few weeks and a lot of things have happened. Actually, my friend who's over here who joined us just now, she's the one who has the COVID. I think
Mm.
by now it should be much better. Like it was diagnosed about almost a week ago, I believe. So good morning, Anilji. How are you? Good to see you. And we have Dr. Jameel here with us. And as you all know, that she's been coming to a program for the last year and a half, I believe. And today we're going to be talking about a very important couple of different subjects. Amongst them is the high blood pressure, and we'll touch a little bit about the COVID also, and also a couple of other things. And as you know, that the doctor is she's in around Dallas area. She's been there for a while. She used to be in, I think, around here in New Jersey before. Then she moved over
Mm.
there, right? So she's been in this country for a long time. So थोड़ा सा अपने बारे में आप भी बताएं, अपडेट करें हमको. It's been a while. So good to see you though. Very
Yes,
nice.
hi, good morning. Yes. Yeah, अपने बारे में बहुत ज़्यादा change तो नहीं हुआ, but um, I work here in one of the hospital as hospitalist. I have my certification in internal medicine, but I work in the hospital. So hospitalist, then plus I have done a few other certification like obesity medicine or lifestyle medicine. तो उसमें ये है कि that just I'm just trying to incorporate those in the
Around
mainstream
Dallas area. Sorry.
medicine.
Okay, so then you specialized in that. I remember we touched the subject to obesity, right? आपने
Mm-hmm.
किया हुआ है, certify.
Obesity medicine and lifestyle. So just trying to see that, I mean, of course, we try to use medicines in each and everything, but lifestyle changes and modifications is still very important. And sometimes it's work better than the medicine itself.
Oh yeah, I think always with everything, the doctors always tell you walking, diet,
Mm-hmm.
lifestyle changes. Like those don't be too
Mm-hmm.
much TV after. I mean, I just went to the dietitian last week, and he said after every meal, you gotta eat. He gave me some ideas what to change my diet a little bit. But he said after
Mm-hmm.
every meal, including breakfast, lunch, whatever, try to walk for 15 minutes.
Mm-hmm.
If you don't want to do it
Okay.
one
Is
time,
it like before or after?
after you eat, I think.
Mm.
So try to
Okay.
walk,
Yes.
walk for 15 minutes at least.
Mm-hmm.
This way the food will be, and then you can eat a little bit snacks. But he basically just, I said, I'm getting bored of eating the same thing for breakfast.
Mm-hmm.
Some ideas. And
Mm-hmm.
that's when he told me eat peanut butter with, I said I like fruit and I don't like toast because my other dietitian told me something else. So he said, no, you don't have to take toast if you don't like it. He said, but
Mm-hmm.
fruit and take some nuts. So that's why we went over that. He said, but make sure that you walk, do some
Mm-hmm.
walking. So I said, well, I have a lot of steps in my house up and down. He said, do that, do some, not necessarily you have to join the gym, but if you can do these things, that makes a big difference.
Yes, yeah, yes, for sure. And sometimes, that going to gym, it just feels a little bit overwhelming, especially when you see people there. I mean, sometimes for some it can be overwhelming, but sometimes it can be very, you can get motivated. So it
Yeah.
just depends how you feel it.
See, in my case, I had that problem. I mean, I love to go to the gym. Since the COVID, I have not really gone back, although I can go back anytime. I'm just delaying it or being lazy. But when I used to go there, uh, the only reason I used to go, basically, I had the trainer, so I had an appointment with him. So I said, "Whether I want to go,
Then
I
you
have to go
had to
now."
go home.
So that was
Yeah.
that was the biggest. I said, "Oh my God, I can't cancel. I've paid him. He's waiting for me." So
Exactly. Yeah, yes.
so that's what was
Um,
making me go. Now I don't do that.
yeah.
If I do that, I'll have to start do that training again. But that's good because I used to do it for about half an hour, and then I used to join the Zumba class. I used to do the all kind of things. It made me
Mhm. Mhm.
motivated. Once you go
It's
into
just that whenever you get there,
yeah,
then you are good. Then you just
exactly.
have this.
And then you
Yes.
feel so good when you come out. When you come out
Uh,
to the gym, you feel
mhm.
fantastic. So
Yes, yeah, you really feel good.
you feel so good. You can go to the pool. I like to do the Zumba classes after that. I really enjoyed that a lot. And they started doing Hindi music and stuff, dancing music, Bollywood music.
Oh, okay, that's nice.
Yeah.
Yeah.
Yeah. So
Mm.
that's my thing to go. So I have to start doing that again. And a couple of things I have to start going back now. It's time. But anyway, आप कुछ कह रहे थे कि you want to talk a little bit today, touch the subject of BP, right? Blood pressure?
Yes, high blood pressure, hypertension.
Yeah.
So, I mean, of course, as you know, that high blood pressure, it's it's so common that
Yeah.
sometimes it's just taken it very like normal. But um, high blood pressure and plus chronic hypertension, it can cause a lot of problems, especially for the cardiovascular, for the heart. For the heart disease, and then it can cause a stroke, and then there can be several other problems with the high blood pressure. So um, it is something that you have to have a screening whenever you go to your primary care doctor. So of course they have to check your blood pressure, but it also depends how you check the blood pressure also. Sometimes some people, they have, like a white coat anxiety that your blood pressure can go high whenever you see a doctor, or whenever you just go to the doctor. Sometimes it's, you just go there after you had a walk, and then a little bit of stress, and then they check the blood pressure, it's high. So usually it's taken at different time, or in multiple occasions. It's not that if you have high blood pressure just one day you'll just start the medicine, but you can check your blood pressure at home. And so you know that high blood pressure, there are like two stages. When your blood pressure systolic is between 130 and 139 is a stage 1, and when it's above 140, then it's stage 2. So usually when your blood pressure is around 135 or more, then you start the medicine. So, but we just have to talk about doing things before you start the medicine. So that's where lifestyle changes and modifications and things come. I mean, we know most of the things, some of the things we know that what could be the things which can increase the blood pressure and what to avoid. But do you know, or do you think of anything um, which is the main cause or main culprit which we have to avoid?
I'm thinking diet.
Yeah, and I mean, of course, the diet is especially, it's the main thing, but especially we talk about a lot about your sodium or salt
That's salt. Yeah.
intake. Yeah.
Mm-hmm.
So it's, of course, it's the main thing is salt, but there are other things like potassium, calcium, and things like that, which you can add in your diet to prevent or actually lower the blood pressure. So we know that sodium intake or the salt intake, it's the main culprit, as we talk a lot about sodium with the high blood pressure. So usually the recommended daily intake of sodium is basically less than 1 teaspoon, and it's like whole day overall. So you can imagine that we have a very high sodium or salt intake in our daily routine. So if that is the daily recommended intake, you know that how much sodium we usually take. So sodium is there in each and everything. Whenever you eat anything like canned food, processed food, it contains a lot of sodium.
Wow.
Plus, like bread, it has a lot of sodium. So it's so much added that we usually don't realize that how much sodium we are using.
Even in soups, right? Those
Yeah.
canned soup,
Yes. So
so much
canned soup,
sodium. My God,
it
a lot of
has
sodium.
a lot of
Too
sodium. Yes.
much.
Yeah. So canned food plus processed
Mm.
food, That's why we talk a lot about, whole food diet, which is, I mean, of course, more kind of vegetables and whole food, not processed or canned. So even if you see like juices and um, I mean, I think sodium or the salt is just in each and every food. Whenever it's packaged or canned, there is sodium. So you can just see that if the daily recommended intake is just less than a teaspoon, how much you are taking. So which usually it just increases the risk of high blood pressure. So basically that is one thing. Other thing is, of course, you have to just limit the salt or sodium intake, but there are certain things which you can use to decrease blood pressure. So there is potassium, like potassium containing food or supplement. It basically decreases the blood pressure. So potassium, it's found in many vegetables and fruits. So you just have to have dietary, intake to take the potassium. Otherwise, if someone is really low in potassium, sometimes you can have it checked, when you go to see doctor, when they do basic workup, sometimes you can find out the low potassium, which could be when you find out there is low potassium, there could be many reasons for it. Sometimes if you are on any kind of medicines, especially blood pressure medicines, when it's like a diuretic, where you have to have like it's called water pill. So sometimes it can deprive you with the potassium. So that can be the cause, but other medicines can cause it. But mostly the vegetables and fruits, they have potassium. So potassium rich foods like potatoes, sweet potatoes, bananas, cantaloupe. So these are the high potassium containing fruits. So that is something that you can use to decrease blood pressure.
I see. That's without the medicine, of course, this diet.
Yes,
What
yeah.
diet
So of course we are
supplemental.
talking about
Mhm.
basically, I mean, of course, then we can talk about the medicines, which everyone probably, as I said, that it's so common that probably everyone is on one or another blood pressure medicine. So we are just trying to see what are the lifestyle modification we can do, because even if you are on blood pressure medicines, there are not too many blood pressure medicines. And I see that even if people are on 5-6 blood pressure medicine, still their blood pressure is very high. So there are not too many blood pressure medicines, and plus we are not, there is no invention of new medicines every year. So we have pretty much like 6-7 like kind or type of medicines, but the
Somebody
blood pressure.
somebody just asked a question. Can we take garlic clove for high blood pressure?
Yes, yeah. So garlic, the research has shown that it can drop or like around 2 millimeters of mercury of blood pressure can be dropped with garlic. So garlic is very good in lowering the blood pressure. So that is one thing. Then there is calcium containing fruits and vegetables. It can lower the blood pressure too, like, the green leafy vegetables, especially kale. So that can lower the blood pressure. So that is one thing. Then there is another mineral like magnesium, which you can find in nuts like almonds, cashews, like in beans. So that can cause, or that it can help in lowering the blood pressure. So I wanted I know that this is something like a Indian thing. It's Amarnath or
Yeah, it is.
Amaranth.
Yeah,
What
Amarnath.
is it?
I think Amarath. I think that's maybe I'm wrong, but I think that's what it's called. But that is like a Ayurvedic thing. I think it is. If I'm
Because I
somebody
was reading
does
it
it.
that this is
Yeah.
something, it has magnesium, and it can be used in lowering the blood pressure. I mean, of course, I do not know the details of it. Maybe yes, you're right that something Ayurvedic or herb. But I have, when I was reading about magnesium, it looks like it has magnesium, which can help lowering the blood pressure. So, I mean, of course, we talk about a lot about sodium intake. So sodium, if you are taking more, then it can cause, of course, high blood pressure, but there are other minerals. When you have a good amount in your daily intake, that can actually help lowering the blood pressure.
So these
Yes,
are
and
no, you're right. When you go to the doctor's office, like when I get my blood pressure done, I mean, when you sit down before the doctor comes in, you know that because you're a doctor,
you just,
come and check.
you just feel a little bit
Everything goes,
anxious.
I mean, it's a little high,
Yeah.
right?
Yes.
And they ask all these questions, what are your weight? And, you don't want to see your weight. And, you have to put to check your pulse and everything. And they talk to you a little bit, ask you all the questions, what medication you're taking, all that. And you get you're a little bit
Yeah.
So, but when the
Anxious.
doctor, when the doctor comes in, it always happens with me. So then she checks it. She said, "No, let me do it again." I mean, when I speak to my doctor, she's talking to me. How are you? How's this, that? And we start talking. How's your health been? Whatever it is. And then she checks it again, and it's always goes down. Always.
Yes,
Like
yeah.
in my case.
So I think that usually happens when you just become more comfortable.
Yeah.
Plus that's why as soon as you go, sometimes, they check the blood pressure early before the doctor comes. So as soon as you go in, they check blood pressure. So usually that's how it has to be done, that you have to wait a few minutes. Then the right cuff is very important. One cuff cannot, fit all. Of course, sometimes if you are overweight or obese, then they have a different cuff. So if the cuff is not the right size, there can be different reading. Then, of course, doesn't have to be, it has to be over the skin. Not too much of the clothing on top of it. So, and then you have to be rested. Your back has to be straight and rested.
Yeah.
So all these things count.
That's why somebody's asking a question. Shelly ji, she's asking a question. Yeah, what is the best position to measure the BP? Sitting straight or leaning back at the chair?
No, it has to be sitting straight and your back has to be rested.
And also, okay, sitting straight, like straight like that, and then they take it. Yeah, not like that. I mean, not when you're relaxing. Even at home, then you should do the same. Now, is there any difference between the right arm or the left arm when they take the blood pressure?
No, you can take it. I mean, of course, there are certain conditions where there is a blockage of your main artery. In those cases, there is different blood pressure on different arm. But usually it's not. You can take it to any arm. Yeah, that's fine. And plus, when you're taking it at home, of course, try to not do it after. To be at least 1 hour before or after. Because when, of course, when you eat, sometimes increased metabolism and things like that can affect it. And it's good to just keep a log of your blood pressure medicine, different times of the days. So you know what is, because usually blood pressure is not same, different time of the day. So you just have to just take it in different time, make a log. Sometimes you're right, when many people, if they have high blood pressure in the office and at home, they're fine. So that's what you have to check, because you do not want to be unnecessarily on a medicine, because of course, when you start taking medicine when your blood pressure is normal, then it can be very low and it can cause many problems, because every medicine has a side effect.
So if you have blood pressure, how many times in a day you should check?
It depends, meaning that, of course, every individual is different. If some people, they are good. I mean, if you're talking about if someone is on a blood pressure medicine, then they can check it at least once or twice, depending. Because if your blood pressure is stable, like every day, then you just do not have to check it. But if some people, if they are trying to closely monitor while on a medicine, then of course they have to just check more.
Okay, so somebody also asked a couple of questions here. Which machine is okay for blood pressure? There's so many machines outside, we don't really know. Does a particular type of a machine is better than the other one,
Now,
or
I know that now there is like a lot of sophisticated, so they pretty much, the digital, they give the right, like reading. So, I mean, that's what we are using. I know that's not too much of the manual, unless if you're seeing like different blood pressure in different arm, then it's sometimes, as you said, that at home it's fine. When you go, it's just high. Then if you have to double check it, then you can do something manual. But otherwise, these digital, I mean, these are sophisticated. I mean, they pretty much give the right reading. So I don't think there is any problem, because that's what we use in the office and in the hospital too. These are all, it's not manual.
right. Okay, and Shaliji, I think that your question was answered just now. She just wants to know how many. Should you take an average of 3 checking or just one time?
Yeah, again, it's just it's up to the individual, because if you are on a medicine and you are trying to monitor your blood pressure, sometimes with one blood pressure medicine it's not controlled, then of course you have to check your blood pressure at least 2 or 3 times, different times of the day, to see that what are the times when your blood pressure is high. And sometimes if the doctor is adding any medicine, then they have to see that how you can stagger that medicine. Do not take the medicine at one time. So those kind of things. But it's not something that you have to check your blood pressure 2 times or 3 times if it's normal.
Right. No, she said, I don't know. She said, no, I mean in one sitting. I don't understand. I mean, personally, I don't understand what that means, but I'll ask Dr. Erum. Somebody's asking, do know, she means in one sitting. Do you check 2, 3 times? No, I don't think so.
Yeah, so no, I mean, when you are diagnosing someone with the high blood pressure, then it's just not in one reading. It has to be at least 2 or 3 readings before you like diagnose and start the medicine. Because as we said, that if you're taking it just different time of the day, sometimes not the right way and things like that, especially when you are in a doctor's office, as you said, that sometimes you can be anxious and it can be high. So it has to be at least 2 or 3 readings before you start any blood pressure medicine.
So my question is, no, blood pressure medicine I was told to take in the morning. Is that the right time to take it?
No.
No.
You can no. I mean, you can take it any time of the day. Meaning that if your blood pressure, if you're just on one medicine, you can just take it. Just it's a once a day medicine. So unless there is a medicine which is the instructions are take it before meal or after a meal or morning or evening kind of thing, I don't think that there is any blood pressure medicine which is a specific time of the day. What I mean is, if you are taking like 2 medicines, for example, like if you are on 2 medicines for the blood pressure, it's good to stagger. Do not take it at one time. You can just take one in the morning, one at night. So your blood pressure is controlled like all over like 24 hours, like throughout the day.
Okay.
So that is something you can do.
Yeah. No, my question is that there are 2 different. I mean, you're talking about 2 different different type of medication for blood pressure, or
Correct.
same one twice, the same one.
So if it is same one, of course, then it is twice, then you have to take it twice a day, like morning and evening. If it is something is 3 times, then of course morning, 3 times meaning every 8 hours. So you can, it's morning, afternoon, and then evening. But if it is one medicine twice a day, then of course you have to take it twice a day, one in the morning, one at night. Twice a day meaning every 12 hours. So if you are taking in the morning, then after 12 hours you have to take it. But I'm saying that if there are 2 different kinds of medicine, meaning, for example, one is like Norvasc, another one is lisinopril, then you can take it different time, meaning that one you can take it in the morning and one at night.
So what do they prescribe two different types of medications for blood pressure?
Usually you start with, of course, one medicine. And again, it depends on how high is your blood pressure. But if your blood pressure is very high, then sometimes, they add, and certain medicines, they act, like it has a synergistic effect, meaning you can add some water pill to a different kind of medicine. So it has a little bit more pronounced effect, but usually you don't do it as a first line, meaning unless your blood pressure is very high, then they can add two medicine at a time, which has a little bit synergistic effect. But usually you start with one medicine.
I see. Yeah.
Yeah.
Oh boy. So it's
And then I was reading the other day, actually, I was just, listening to this thing, which is hibiscus tea. This is something has shown to decrease blood pressure. It acts like a medicine to decrease the blood pressure. So hibiscus tea is something that, you can just look into and see it lowers the blood pressure. It looks like it's very effective.
just want to ask you another question. Actually, that's long time ago. I mean, a while back, my blood pressure used to be always low. And then I don't know what happened by 7, 8 years ago. I mean, I'm the same amount, 0.5, or very the lowest. I'm still in the
Of
same
what?
I'm taking enalapril.
Okay.
So that's the same. It hasn't changed. But before I said I've always, when I came, it was always low. All of a sudden, she said, "No, it's a little high now. You gotta." She checked 2, 3 times, and she prescribed enalapril for me. But if there's some people who are, I knew somebody who had a very low blood pressure. So what should they do to make it balanced? Like, not to keep it
No, I
low.
mean, if you don't have to make it higher, of course, that's your body, that's how it's adjusted or adapted. So, I mean, usually, unless there are certain conditions when your blood pressure drops or it's too low, that is something like when there is a problem, like when sometimes it's called like sepsis, or like someone has infection, bad infection, they have low blood pressure. That's a different thing. But on a average day, regular, your blood pressure is a little bit, if it runs low, then you don't have to do anything to make it high. I mean, that's the body that has adjusted, and that's how it is. So you don't have to just make it higher unless there is something that it's going so low that you are getting dizzy, and that is lower than normal. Your normal, because I mean, of course, sometimes my normal is, for example, 100. So I'm okay with that. I mean, I don't have to do anything to make it higher. But if it goes so low that you are having symptoms, then of course, then there are other medicines, and there first you have to see what could be the reasons for it. If it is something temporary, or if something that's what you have. So there are certain things or medicines you
Like,
have to take.
for example, what is the ideal and blood pressure? Like, I mean, ideal means normal. And then what is a low? If a low meaning, how much is a normal for low pressure reading?
So I mean, ideal or the normal blood pressure is,
Normal.
that it's systolic 120 and diastolic is 80.
Okay, that's
So
good. I mean, that is good.
that's the normal.
Normal. Okay.
That's normal blood pressure. I mean, of course, 1 or 2 points up and down, it's okay. Again, when it's elevated blood pressure or high blood pressure, you call it when it's like above 120, between 120, 129, it's elevated blood pressure. Then if it is systolic more than 130, then it's like hypertension. Again, if blood pressure is low, if that is your normal everyday thing, then it's not a problem. But if your blood pressure is normal, like 120 or above, but and then your blood pressure goes down, or if it is low, it can be in certain conditions, like sometimes if you have infection when patients are admitted in the hospital, and if dehydrated sometimes, then the blood pressure, then that's a different thing. But if your blood pressure is, for example, just 110, 100 all the time, and that's your normal, then that is your normal.
But how low is, I mean, how somebody's asking that how low is it okay? to be? Like if you're, like you're saying, 120 and 80 is good, normal. Now somebody is always maybe 90 or 95 or 85 or
I
that's
sometimes some
yeah,
people, they have a blood pressure of 90, like that's their like normal.
yeah.
So again, if that is your blood pressure all the time, then that is your normal. Low blood pressure, meaning that if your blood pressure is higher than that, meaning for example 120, and then now it's 90, then there is a problem. So then you have to find out the reason for that, and something is going on with that. Usually people are very sick and
Oh,
very symptomatic if their blood pressure goes down from their average blood pressure. So usually we see those kind of patients or people in the hospital.
okay. I mean, they have some kind of a, they're not well. There's something is going.
Correct, yeah. So then they're not well, meaning sometimes you can be, if you are taking blood pressure medicines, that you're not keeping up with the hydration fluids, it can go very low. You can be dehydrated. Sometimes you're out, not keeping up with your fluid, and you are on blood pressure medicines. Your blood pressure can be very low. Then sometimes, you know, if you're sick, like infection, like sepsis and septic shock and things like that. So those are the cases where you're very sick and your blood pressure can be very low. Then of course there are medicines to keep the blood pressure high. You are basically admitted in the ICU for that.
Wow.
So yeah, so that is something that you are really sick when that happens.
And that happened. Wow, that is bad. That means somebody's
Mhm.
with well. And
Mm.
also, how much does that emotions or your mental health play a role in
Mm.
the, like sometimes you're upset or
And then your blood
stressed,
pressure just shoots up. Yes, yeah, and that
stressed.
happens because of course with the stress um, and anxiety, of course, what happens is if this is all your, you know, blood vessels, sometimes your blood vessels contract, dilate, and things like that, and that's the pressure in the blood, right? So that can be changed because of stress. Sometimes, you know, when you're talking very loud, sometimes you're shouting, screaming, things like that, your blood pressure can be high. So these are the things, I mean, these are certain factors which can be, but of course, then again, that is something can be temporary. But if you are always in stress, then can cause the problem. Um, so that is something, of course, then that's why this is sometimes it's, again, you can be on medicine, but then you have to have some lifestyle modification, stress management and things like that to keep it under control.
Somebody asked that is alkaline water good to raise the BP?
I don't know what is alkaline water.
Alkaline water. Yeah,
Yeah,
you can.
what is it?
Shali ji, आप explain करें. Shali ji, please.
Maybe no,
Um,
I don't know
some
about that.
alkaline in the
Tell me what is.
water, something in the water that's the, you get it nowadays. I've been seeing it. I didn't see it before, but recently I've been noticing they have alkaline water. So I don't know. I haven't tried it. I don't
Is
know
it
what.
like something with energy drink and things like that?
Shali ji, is that anything like
No, I
that?
think probably I mean, I know that whatever the bottled water is, I know that sometimes they have seen that it's very acidic. You have to have a normal pH balance of those bottled water. And some of the bottled waters, you know, they are better than the others. So of course you
Okay.
have to have your own research, but I don't know that I mean,
She's
whatever
saying,
should be a normal water pH, you
yeah,
have to drink that.
she said it's H2 alkaline ionized water.
Oh, okay, yeah. Maybe something more more fancy things, but I
I
know
know
that the bottled water has to be at a certain pH, you know, like whatever the
pH
water
balance, pH
needs to
balance
be.
water,
Yes,
pH balance. Yeah.
pH value, huh? Yes, because you know that I mean, God knows what is in the water bottle is and where you are collecting all those water. But I know when you do some research that there can be a little bit more acidic than the others, and then it has to have a normal pH balance.
pH
You know,
balance.
that's why they say that spring water and things like that, which is more closest to, you know, the water you should drink.
So I mean, even the water we don't know. I mean, everybody's drinking from
We
the
don't
bottom.
know.
We don't know where it's coming from. I
Mm.
have no idea. They keep on saying spring, this, that. But the tap water is
Right.
completely out. Nobody can open the tap anymore and drink water from there. Very
Drink it. Yeah, I know that. I
That's
mean, of
totally
course,
out.
now the water quality, of course, I know like years ago, um, people just used to drink just tap water because the quality was so good, but I don't think anymore.
Yeah, that's why Kamlesh is asking, is it okay to take all these different kinds of waters in the market than just the regular one? Regular one means what? So regular one is one we can
We don't know what is the regular one.
exactly. We don't know
I
what
don't
the
know what
regular
is
stands
regular.
for. I have
Yeah,
no idea.
exactly. Yeah,
We don't
yes.
know.
So I think you just have to have your own research, sometimes, when you see and then compare because I know that I have seen certain videos and I have read it that there are different water bottles with
Yeah,
different sources,
like
and then they can be very different in their pH balance.
like for example, when I'm like I said, I'm going to Aruba, which I go every year, and over there the tap water is safe to drink.
Mm,
I have to lug so
really?
many bottles in. People do that, but when I go there now, that they said you can drink that water from the tap. It's fine. It's good for you. There's nothing wrong with it. So I said, you know what? I stopped buying it. When I go there, I don't buy it anymore. But my kids, they still like to buy. They're used to it. They go out, they buy the water. But I stopped buying it. I said they're saying it's written over there in the hotel. They said it's fine. It's safe to.
Then if it yes,
Yeah,
if it is, then
yeah. They
otherwise,
don't buy it.
if it's not written, then
Otherwise, normally you can't open the tap anymore and drink the water anymore.
I know you cannot,
No such thing. There's no such
because
thing. I mean, this is the lifestyle is totally different. So yeah, people are lugging so much water bottles to the house.
mm,
Or I have that machine in my house, which I
yeah,
put
that the filter. I know that
the filter.
now, I mean,
So
of course, the
yeah, I have the
refrigerator has
filter.
its own
Yeah,
filter and things.
exactly. I have the filter, so I use that water for myself.
Mm,
That's what I've been using in the house.
mm.
But a lot of the people, they go out, they take the bottles, they go here, they take the bottle. I'm drinking right now because I didn't bring my other water, I didn't bring it down. So my
Mm.
bottles are right here in my garage. So I pick
Yeah,
one.
I mean, of course, for the more, if you want to be a little bit green, and that's why they say that, like now in many resorts and hotels, it's just the refill, meaning just you just take one bottle or your bottle and just refill, right? The
Yeah,
filtered
that,
water,
yes.
not to use those plastic bottles all the
Right
time. That's
there,
too much.
either you take your own bottle and fill it because they have
Mm,
all in the hotels. I mean, it's different. They even have small bottles, or they have the refills stations everywhere. But it said
correct,
that it's
yes.
safe to drink the water from the tap. It's okay. There's
Mm,
nothing wrong with that water. So that's what they tell us over there. Just said, no, you don't need to get the bottles, buy the
mm.
bottle. So I stopped buying.
Then there's no right, yeah,
But
if you don't have to.
yeah, I don't have to. They said one place in one thing good they say is there's no rain in Aruba. You can enjoy, and then you don't have to get the water from the buy the bottles of water. You don't have to do that. So, but nowadays it's raining there too. I mean, they guarantee you there's going to be no rain, but it rains for 5 minutes and then it goes away. So, like I said, everything is changing in this world.
Things
The
have changed, yes.
weather is changing and everything.
Mm.
But that means if somebody is very, let's say somebody is very excitable or got very angry or upset or depressed, then the blood pressure shoots up. That's not really good for them. Anybody
Mm.
excited to do that.
Yeah, yes, yeah.
Yet to see a lot of people, they get very
Yeah,
excited.
and plus, I mean, of course, if you are in pain, pain is a very, that's what we usually see also. And sometimes, pain is basically very subjective, right? Your pain threshold can be different than mine. For example, um, tolerate pain. If there is a cut, someone cannot. So it's very subjective. So that's how you check if someone is in pain. Sometimes their heart rate and blood pressure can go high. So that is one thing which we usually see in patients too, to just check that if they are in pain.
Also, the BP when somebody is pregnant, for example, that time they really check the blood pressure all the time because
Blood pressure and blood sugar, it has to be checked because sometimes it's just during pregnancy you can be just have high blood pressure and then diabetes. So that is something which is usually, and sometimes I know that that has been, and I know sometimes, young people, they usually don't go to doctors and plus do not check it regularly. And we have seen a lot of people who usually come to the ER with so high blood pressure where you have to start like a IV medicine to control it. So that is usually when you're not checking it. But as we are seeing a lot of problems early age, of course, that high blood pressure is one of them.
Wow.
Kids can have that too.
Kids can have it too. So even at what age the kids should, I mean, what age should the doctor start checking the
Yeah,
pediatrician?
because I know that usually when you go to pediatrician, they check the blood pressure also. So
Okay.
yeah, they do. So I mean, of course, they have their pediatric blood pressure cuff and all.
Right.
So like our pediatrician, they check the blood pressure. So I mean, they have been checking it since they were. I mean, of course, I know that not very early, but probably 7, 8 years they start checking.
Really? Oh, good.
Mhm.
Because
Mhm.
that's so I don't go. I haven't been with my grandkids for a while to the doctors, so I don't know. But so that means, but girls when they're 11 or 12 years old, they're checking them. The grand-
Mm-hmm. They usually check the blood pressure.
So if it's
So
high,
that's
if the kid has a high, so they also get medication then? What are they? What is?
yeah, probably. And again, then that's why, I mean, of course, this is sometimes, again, if it is just one time thing, you start with some lifestyle modification. And usually when you're obese or overweight, there
Mhm.
you have high risk of high blood pressure. So sometimes,
When,
even if you lose around 2 pounds, it can lower the blood pressure about 2 to 3 points of blood pressure. So that is very much correlated.
I see.
And I think I was just reading that some of the vegetables which are very high in nitrates, like a nitric oxide, that is good to decrease the blood pressure too. Probably you have heard about, whenever patients with angina, chest pain, they do nitrates right under the sublingual or under the tongue to
Oh,
relieve
oh
the
yeah,
chest
yeah.
pain.
I've heard that.
Yeah,
I've heard
so
that.
that medicine which it lowers the blood pressure, plus it dilates your blood vessels to increase the blood flow to the heart or any part of the body. So naturally, nitrates which are present in vegetables, you can use them to decrease the blood pressure, because nitrates in vegetables, it changes or it converts into nitric oxide, which in turn dilates, dilates the blood vessels and increase the blood flow and decreases the blood pressure too. So like celery, lettuce, spinach, and these kind of vegetables, they are very high in nitrates. So that can be used to decrease the blood pressure.
That's
So
good for a diet. It's a good diet. And I think the kids who watch too much TV or they don't move around that
sedentary.
much, sedentary
So
all the
not
time.
no physical, because what happens is exercise, when you do exercise, your it's called endothelium in your blood vessels. The blood vessels inner line, it produces nitric oxide naturally, which in turn dilates your blood vessel and it decreases the blood pressure. So when you do exercise, it improves the function of that inner lining of the blood vessel. So that means in turn you have high production of nitric oxide. So when it's higher, then it controls the blood pressure, lowers the blood pressure. And in turn, I mean, of course, it's in improving the blood pressure. So exercise, that's why it's good to have to lower the blood pressure. Plus nitric oxide, you produce it naturally, but of course you can have certain food, as I I just mentioned, like vegetables and all, to improve the quantity or increase the production of nitric oxide. So exercise is always good because it can basically lowers your blood pressure. And of course, it helps with the diabetes too, because nitric oxide, it regulates your insulin. So this
Okay,
is
just a quick. I just want this is I just wanted. I just thought of this question. So when you are like the two type, when you are having the low blood pressure, so what kind of a body feel? Do you start getting a headache or some kind of
like
a
abnormal low blood
what
pressure.
kind of,
We are talking about if abnormal low blood pressure, meaning
yeah? If you
your
have a
blood pressure
like
is always good, but now it's low,
something is
then
bothering is going
yes.
down, how
Mhm.
what kind of feeling do you get in the
Usually you feel dizzy,
dizzy?
tired, fatigue,
Okay.
yes, headaches. Sometimes, usually headaches is usually when you have high blood pressure, but sometimes it's like dizzy feeling.
Oh, dizzy. So then
Mhm.
that's a good time to check your pressure. That's the good
Yes,
time
yeah.
to check.
So sometimes
Right away.
usually that you, especially if you are on a blood pressure medicine, because sometimes, it can, again, as I said, that you are not keeping up with your fluids and you
Mhm.
are on a medicine which lowers the blood pressure, you are dehydrated when you are out, and then you are feeling dizzy, tired, then of course,
Mhm.
then you have to check your blood pressure and monitor that.
And the opposite question is that when you get excited or you're in some kind of a meeting or some meeting some people, something happens that you start having a little uh, maybe a mood problem or something, and you are excited and then your pressure goes up.
Mhm.
And what happens to the like your face is flushed or what is a how does our body react to that?
So sometimes it can be just, temporary because,
Yeah.
that's a body natural mechanism, to control all these feelings. I mean, if it is temporary, for example, when you are scared, when you have fear, then there is body own mechanism to do certain things. When you're
Mhm.
anxious, it's body own natural defensive mechanism. And of course, temporary, you cannot do anything. But if you're saying like, someone in stress all the time, it's a constant thing, then of course you have high cortisol level, then high everything, then it's a constant thing, then that's a problem. But certain things which is temporary, it's a body own mechanism defensive. So temporary, I don't think then you have to do anything about it. But
Okay.
if it's a constant, your
Right.
lifestyle is that you're constant in stress, then there's a problem.
Hmm. Wow. So anybody has any questions? Please you can ask them now. And we do have
I
a
was reading again the other thing about the use of mouthwash also. That was the other thing which I was wanted to talk about, because the mouthwash usually it it kills the bacteria on your oral cavity, which produces this nitric oxide. So
oh,
nitric oxide, as I said, that it's very important and it's a good thing to lower the blood pressure. You can have vegetables or fruits which are high in nitrates. So mouthwash, it kills the bacteria, which decreases the production of nitric oxide. So you have to limit the use of mouthwash also. And sometimes maybe just use something very natural, not with alcohol or other things, which can be very harsh on your oral cavity.
I see. Good.
Mhm.
That's good to know that. Yeah.
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 So, I mean, these are, I mean, sometimes very common thing which we usually do. And then sometimes you do not know what you are doing, which is just causing the high blood pressure. But there are certain things which can be checked and done before it gets too bad.
Right. That's true. Prevent.
Because these are the things which have been researched that these are effective. It's not, that it's it will take sometimes just dietary changes, just 2 weeks of it can lower the blood pressure. Sometimes, that this exercise and physical activity,
Mhm.
it can do it just, in a week or so. Just as I said, that just weight loss, like only 2 pounds can lower the blood pressure. So it is all like research and very effective. It's not something that it's just there. So these are effective. And even if you are on medicine, you still have to do it. As I said, that there are not too many medicines.
Right.
But if you're doing all these things and you are on medicine, like for example, you are on medicine and you just start doing some more exercises or
Right.
doing some kind of hibiscus tea. So to try to just check your blood pressure, because it may, of course, it's effective and it can lower the blood pressure. Then your blood pressure medicines probably needs to be changed or have to have a decreased dose, because you do not want to lower your blood pressure
Right.
too much, which can cause problem.
That's true. Too much low is not good also. I mean, should be try to it's not perfect, but everybody try to make it perfect, like in the range that you just said, between 120 to 80, I think, right? Or was it 120? I think
120, yeah.
120, yeah. So can these herbal foods lower the BP? I read mint lower the BP. Is this true? Somebody read that.
Mint?
Mint. Mint.
I don't know about mint.
120 to 80 is a good normal. She's saying, can these herbal foods lower the BP? That mint lowers the blood pressure. Is this
Mint, I'm not sure about mint. Maybe, I mean, of course, I mean, again, anything, you know, like as we discussed, like have more potassium, calcium, magnesium.
that lowers?
Yeah, so these kind of things, like anything would have high nitrates. So any vegetables, fruits, which
I think,
can lower your blood pressure. So I don't know if
mint
the
is
mint
also,
has.
yeah, mint is also green. I mean, the one we pick up from the garden
Mm,
or something, it's a green also.
Yeah,
But
so I mean, of course, we know that mint is very good for anti-inflammatory
exactly,
and things like that.
yeah,
So I'm pretty sure that it has good effects, and sometimes, you know, like especially the antioxidant, you know, it basically improves the production of nitric oxide, like vitamin C, vitamin E, and things like that. So these are good too.
and somebody saying, Ashaji is saying that cinnamon and cardamom, they also lower the BP.
Because I think they are anti-inflammatory, basically.
And yeah, I think cinnamon also lowers the diabetes sugar.
Correct. Yeah. So anything anti-inflammatory, you know, like it decreases the inflammation in the body. Maybe it just decreases the hardening of the blood vessels. So anything which does that can basically lower the blood pressure and improves the sugar level.
Yeah, that's true. That's what. So these are two, cinnamon and cardamom. Yeah, do lower the blood pressure. Okay, these are.
And
So
the turmeric.
yeah, turmeric. Yeah, that's a
Mhm.
very, that is good for so many things. It heals so many things in the body too.
With the anti-inflammatory effect, yes.
Yeah, so can we make it like a powder of all this and put it in the drink?
Actually, I did it. I mean, I did for myself, you know, and it's just a combination of cinnamon and powder in the powder form. The cardamom, which is the green lychee,
Right.
and then turmeric. And then I just used to drink it. It's called like, you know, like a golden elixir or something. You can mix it in milk and can
Right.
drink it too. It's very tasty. Yeah. And I just usually add a little bit of honey. Then it's a very good drink.
Okay, so you can put that in milk or something or anything like that.
Milk or anything, yeah. But I mean, I used to just drink sometimes warm milk. It feels good too.
And ginger is also good. I think ginger is good for the gut.
Ginger, yeah.
Ginger has its
Yeah,
own.
ginger tea, like you do it, ginger tea, and
Yeah,
you can
ginger
add
tea,
ginger and hibiscus tea and things like that. Yeah.
hibiscus tea. I want to buy that tea. Sounds like a good thing. So I want to thank you all for joining us today, and thanks for all the questions and all of for attending this program. Dr. Jameel comes approximately once a month. So and then we bring different topics. So today was blood pressure. We thought was a very good subject. And all these questions that you asked. So I'm sure a lot of you learned a lot of things. You know, Doctor explained a lot of stuff to all of you. I'm sure there's a lot of things which you had in your mind. Shelly asked a lot of questions. So I want to thank all of you for joining today. And we're going to come up with another topic when Doctor comes back next month. So think of something that you can suggest, and you can write
Right,
to
yeah.
us on the message that we can discuss next time. That'll be very good. So that we can pass on, and then the message, and we can discuss about that next time. Meantime, otherwise, if I don't hear anything from you, then we'll come up with a good topic, so which all of you can enjoy. And if you have any questions, do so like you did this time, and Dr. Jameel will definitely answer. And like I said, she's based in Dallas, Texas. She's a doctor over there, and very, very nice. And she's so nice of her to come and join us and give us all this explanation, take time from her days off, and come and do this for us. So Dil Diyan Gallan, really, we all are very thankful to the doctor.
Yeah,
for doing
thank you. Of course, it's my pleasure.
Yeah, thank you so much. So we'll see you back. Actually, we'll be back here on Wednesday with the 3-4 people coming from one person coming from Canada, one from 2 places in India, 2 people are from India. So do join us for a very nice musical program. Okay, you can talk about thyroid. Asha ji is saying next time we can talk about that. Thyroid. That's a good
Okay,
topic
that's
too.
good. That's good.
It's a good topic. So please do join us on Wednesday with this nice group musical program. Wednesday at the same time, same place at 10:30 a.m. Eastern time. Thank you. So have a wonderful day, everyone. And thank you so much, Doctor, for joining us. We really had
Yeah, of course.
very good session with all these questions and answers. A lot of things are clarified, which, need to be when people ask
Yeah,
questions.
of course, anytime.
So next time, suggestion was to talk about
Thyroid. Yeah, that's a very good topic. Maybe I can, yeah.
Yeah. Okay, so thank you so much once again, and thank you all for joining. And I'm gonna go back to, let me take a picture, which I didn't take. Okay. So bye everybody. Bye.